All right, so the CDC just made a pretty big adjustment in their guidance on what people should do if they test positive for COVID-19. I'm going to get into a lot of the details here, but basically the gist of it is they're now saying that if you test positive for COVID, you are only going to have to isolate for 5 days and then wear a mask for 5 days after that, instead of having to isolate as it was before for 10 days and then wear a mask after that. So let's just go ahead and get into some of the details because, to say the least, this is coming not only at a very weird time as we are having a massive surge in COVID cases and hospitalizations, largely due to the Omicron variant, but it's also coming under pretty suspicious circumstances, as we are going to get to here in a minute. But I got a good breakdown here from Common Dreams from Julia Conley, who says new business-friendly CDC guidance on isolation for people with COVID-19 is reckless, experts say. So they say workers' rights advocates accuse the Centers for Disease Control and Prevention of putting business interests ahead of public health Tuesday after the agency released new guidance for asymptomatic Americans with COVID-19, while experts express concern that the guidance will result in confusion and more transmission of the disease. And the CDC announced late Monday that instead of isolating at home for 10 days, people who contract the virus will be advised to isolate for only 5 days immediately after testing positive. And if the person is asymptomatic after 5 days, they may return to work, key point, return to work there, school and other activities, but should wear a mask everywhere, including at home if they live with others for 5 more days. So just off the jump, okay, this is something that I don't really understand, and I get it. The mask is supposed to reduce the capacity if you have COVID to spread it to other people. But if you're concerned that a substantial amount of these people that are going to be going out of isolation after the initial 5-day period, if you're concerned that a substantial portion of them are going to still be COVID positive, which they easily could be, because you're not demanding that they take a negative test here, but they could still be not only COVID positive, but they could still be transmitting the virus to other people. So if that's the reason why you're telling people they have to wear a mask after the 5 days, then why are you telling them to go out of isolation in the first place if there's a solid chance that they could still be spreading the virus? That just doesn't add up in my head. But it not only doesn't add up in my head, but they're also directly contradicting themselves and using very vague language here in some of the guidance. And this is a really big problem that they need to clarify. But as pointed out here from Eric Columbus, he says the new CDC COVID guidance contradicts itself. At one point, it says you can stop isolating after 5 days if you're asymptomatic, but later it says you can do so if you have no symptoms or your symptoms are resolving. And this is a part that really doesn't make any sense in my head. If you have no symptoms or your symptoms are resolving after 5 days, that could mean literally anything. That's entirely arbitrary and up to whatever the person who has COVID decides is symptoms resolving. Okay, you could be virtually on your deathbed or near having to go to the hospital, and then you start to perk up the next couple of days while you still have some symptoms, whether they're mild or not. But that's completely arbitrary, okay? Symptoms are resolving. Again, just a random standard that they are putting out there, not specific at all, okay? So that's part that doesn't make any sense at all on top of that. But now let's get into why they might actually be doing this, because, I really don't think, even though they're making arguments like, we're doing this because the initial transmissibility of the virus is much higher when you first test positive for COVID, and then it starts to trail off the longer that you have COVID. I get the justification that they're putting out there, but there are obviously other things that are being factored into this. And this is not me being a conspiracy theorist, because as we're going to get to, this is literally basically what Dr. Fauci and Dr. Walensky from the CDC are saying is the reason. So this is a story that only came out a week ago, okay? December 21st, 2021, Delta CEO asks the CDC to cut quarantine time for breakthrough COVID cases. So did he do this because he was so concerned with the public health or the situation with his workers and their health? No, not at all. In fact, it's the opposite of this. So they say here from Reuters, Delta's CEO and asked the head of the U.S. Centers for Disease Control and Prevention on Tuesday to shrink quarantine guidelines for fully vaccinated individuals who experience breakthrough COVID-19 infections, citing the impact on the carrier's workforce. So this guy, this absolute demon of a CEO, doesn't give a single solitary shit about his workers and their health. Instead, he is saying, I have so many sick workers that I'm not able to meet demand for the flights that we should be, sending all around the country, again, as we are in the middle of a massive Omicron surge. But this motherfucker motherfucker, instead of caring about the actual health of his own workers who are having to leave because they are sick with COVID, instead of giving a shit about them, he's turning around and begging the CDC to cut the quarantine time so that he can force his workers to come back to work earlier than they maybe necessarily should have. So he's literally prioritizing his own profits and the bottom line of his shareholders for Delta over the actual health of his own workforce. And it appears like, unfortunately, the CDC is listening to motherfuckers like this. And don't take my word for it again. Let's just hear it straight from the mouth of Dr. Anthony Fauci himself. So Dr. Anthony Fauci said the changes were aimed in part at keeping society running smoothly. This sounds a lot like something you would have heard from somebody under Donald Trump, okay? Quote, with the sheer volume of new cases that we are having and that we expect to continue with Omicron, one of the things that we want to be careful of is that we don't have so many people out. Let me just say that again. As we have a massive Omicron surge right now, okay, we're averaging, keep in mind, like 1,500 deaths per day. This is what they are saying is okay. Not only is 1,500 deaths per day acceptable right now, apparently, in the United States, which is, apparently this massive death cult or some shit, but not only is he saying that 1,500 deaths per day is okay, but he's saying we are going to loosen the restrictions as we have 1,500 deaths from COVID every single day, and saying that it is because we don't want to have so many people out. And what does he mean by that? He means we don't want to have so many people out of the workforce. We don't have so many workers getting sick so that they're at home trying to recover from COVID. And we want them to get back to the workforce as soon as possible so that we can maximize the profits for corporate America. That is literally what he's saying here. And he makes it even more clear, continuing on, saying we want to get people back to the jobs, particularly the essential jobs, to keep society running smoothly. Okay, we want to get people back to jobs, particularly the essential jobs. So what he's saying here is this isn't necessarily going to apply to, some white collar jobs where people can work from home and be comfortable and safe in their little bubbles. What he's saying is we need to get the working class back to work. That's what he's saying. We need to get the poors back into the workforce, okay? Even if it means potentially jeopardizing their health or the other workers around them. That's what he's saying here without any, opacity to this, without any ambiguity to any of this situation. That is literally what he is saying right here. He is saying we are willing, as a society here in the United States and our capitalist hellscape that we live in, he is willing to sacrifice countless lives of American workers in order to prop up the stock market and in order to feed the machine that is our capitalist system. It's absolutely batshit insane, and that's not the only thing that the CDC has been doing recently that's insane, and we're going to get to that in a minute. But just another take here from the CDC director. Okay, it's not just Dr. Fauci saying this. The CDC director, Dr. Rochelle Walensky, also said concerns about economic activity provoked the new guidelines. I mean, they're literally just saying it as the fast-spreading Omicron variant overwhelms airlines, hospitals, and other businesses, which is another key point. As Dr. Fauci also said, they're simultaneously saying all of our businesses, including the airlines, the hospital systems, they're being overrun. Therefore, we need to loosen the restrictions to allow for COVID to spread even more. It doesn't make any sense unless your position is literally we should allow a bunch of people to die in order to keep the economy going. Okay, it's completely fucking crazy, but. They continue here saying that sick crew members forced the cancellation of thousands of flights on Christmas Eve and Christmas Day, and the spread of the variant is significantly diminishing the healthcare workforce at hospitals across the country, according to the American Public Health Association. So they also cut the guidance for nurses who are COVID positive to go back to work as well. Again, not because the science is dictating that necessarily, but majority of it is because these hospitals want to maintain their profitability, okay? They want to keep these workers coming back in a shorter duration of time so they don't have to, hire more people. God forbid they spend more money on that. But they are literally only prioritizing their bottom line in making decisions like that. And again, that's not being conspiratorial. If you watch my channel, you will know that throughout the entirety since we've had vaccines, I've been extremely pro-vaccine. I tend to lean towards trusting what these people are saying. Usually a lot of our, health institutions, even while recognizing the perverse nature of the capitalist for-profit nature of whether it's big pharma or the health insurance companies, etc., you can recognize all of that and you can understand that nuance, but you don't even have to take a leap of faith here, okay? You could still trust these institutions and just look at what they're fucking saying, okay? They're not even trying to cover it up. They're not even lying about it. They are openly saying we're doing this in order to protect the profit margins of these billion-dollar corporations. They are saying that, not me, okay? So you just have to listen to what they're saying. But the nurses union was trying to push back on this, and they say, as Common Dreams reported on Sunday, the CDC's amended guidance for healthcare workers who, as of last week, are advised to stay home for 7 days instead of 10 if they are asymptomatic and test negative, negative alarmed the nation's largest nurses union, which said the guidelines were changed in the interest of hospitals, business operations, revenues, and profits. Okay, so there's the largest nurses union in the country that is literally saying they're not making this decision to protect healthcare workers. They're making this decision to protect their own bottom line. So we got a little bit more takes here from some different doctors who were trying to weigh in on this. And one was Dr. Megan Ranney, an emergency physician at Brown University, who also expressed concern that the new guidelines, quote, will too easily move to go back to work when you have symptoms. So she's talking about, sort of a slippery slope here, and that many people who come out of isolation after just 5 days will not actually, strictly wear face masks after the isolation period. That's also true. Okay, people are probably going to largely be reading into this as in like, oh, it's just a 5-day isolation period and then I'm free to go on my way. But again, even if you had masks on top of the 5-day waiting period, well, you could still be sending out infectious people to go back into society, and whether or not they have masks on their face, that doesn't guarantee they're not going to spread it to other people. So again, just not really based in the science, it appears like. But another take here from this time from Dr. Aaron Glatt, a spokesperson from the Infectious Diseases Society of America, pointed out that the shortened isolation timeframe will make it more likely that people will return to normal activities when they are still infectious. And again, they say the majority of the infections are you're most likely to be infectious within the first 1 to 3 days when you test positive. But that doesn't mean that that's a hard line in any way, shape, or form. You could definitely easily be past that 5-day waiting period and still be highly infectious. Okay, it's just an arbitrary guideline that they are choosing to lower here. But there have been some other things that were floated around in terms of what they could have done better here. Required a negative antigen test after 5 days, had different guidelines for vaccinated versus unvaccinated, specified higher quality masks, etc. So there are a number of different things they could have done to try to clarify this more. But in a broader sense, it just appears like it doesn't make any sense. And this is something that also, just to give you an idea of the United States position in this relative to the rest of the world, this is something that it appears like no other major countries are doing. Okay, so it's not as if they're just looking at what the Omicron surge is looking like and then making an adjustment purely based off the science, because this is not something that is happening in other major countries. And we got to take here from a UK epidemiologist, Dr. Eric Feigelding, okay, crazy name there, who pointed out that 2 negative tests are required before people can exit isolation in the UK. And he said, quote, but somehow a 5-day exit with 0 negative tests is okay in the US, he said. American exceptionalism does not apply to a pandemic virus. So listen, I think he's 100% right here. And again, this is not the only area that we have seen the CDC come out prioritizing the profits of large health insurance companies and big pharma over actual public health. But this is just something else that they just posted. I mean, this was posted yesterday, okay? This is absolutely fucking wild. And in fact, I think I'm going to do a standalone video on this alone, because this deserves an entire breakdown in terms of how demented and wrong this is at so many different levels. But you get the gist of it here. They are literally weaponizing medical debt to try to encourage people to get vaccinated. And again, I'm somebody who's in favor of the vaccines, but this is fucking crazy, okay? Hospital stay, you see the dollar signs there, COVID-19 vaccine free, and they say the average hospital stay related to COVID-19 can cost thousands of dollars. A COVID-19 vaccine is free and drops your risk of being hospitalized from COVID-19. Okay, the hospital stays should be free as well, okay? We've seen so many studies throughout the entirety of the pandemic that said a single-payer Medicare for all type system could have saved potentially hundreds of thousands, if not, tens of thousands of lives here in the United States during the pandemic. And instead of recognizing that and going out there and pushing for a single-payer system, as they should, as the fucking Centers for Disease Control, instead of actually going with what the science is saying, they're turning around and threatening people with medical debt. Okay, this is fucking psychotic. So listen, I'm probably again going to do a standalone video on that graphic alone, because it's just so fucked up in so many different ways. But in the broader picture of this, I'm not saying it's 100% out of line with all of the science. I kind of get some of the arguments that they're making about your increased likelihood of being infectious at the earlier parts of this, but it seems like their priorities are pretty fucked in this situation. And it seems like, and you don't even have to go out on a limb to guess this, and it's not conspiratorial, because it's literally what the CDC director Walensky and also Dr. Fauci are saying. They are prioritizing the economy right now. They are prioritizing basically being willing to sacrifice thousands of American workers. Okay, again, we're averaging 1,500 deaths per day right now as they are loosening the guidelines. Okay, and they're prioritizing, or basically accepting the fact that we are going to have countless needless deaths of American workers. They were very careful to specify the working class, the essential workers in this country. They are willing to sacrifice thousands of them for the stock market. They are willing to sacrifice thousands of them at the altar of capital.